is Aaliyah Katz. I'm going to be doing an IV catheter insertion. So the first thing that you want to do is check the accuracy of the order. Then you want to do some hand hygiene, and then you want to gather your supplies. We have our skin prep, our alcohol swab to clean it, our tourniquet. We have our needle catheter. It's a 20 gauge, because it's pink. Then we have our transparent dressing. We have our stat lock, our J-loop, our saline flush, and some gauze. I also have gloves. So I'm going to go ahead and attach the saline to my J-loop and prime it. And then I'm going to do patient identification. I'm going to ask for their name and date of birth. I'm going to provide some privacy, and then I'm going to ask for their non-dominant arm. This is their left arm. And then I'm going to go ahead and apply my tourniquet. And then I'm going to go ahead and put my gloves on. So now I'm going to get my alcohol swab. I'm going to go ahead and clean my site. I'm going to let that dry all the way. And I'm going to go ahead and get my needle. I'm going to apply traction. I'm going to insert it at a 15 to 30 degree angle with the bevel up until I have blood flow. And then I'm going to advance it a little more. And now I'm going to just advance my catheter until the hub is at the skin. I'm going to occlude it, and then I'm going to remove my tourniquet. Now I'm going to take my J-loop and attach it to the hub. And then I'm going to go ahead and I'm going to apply my stat lock and my transparent dressing, and I'm going to initial, time, and date it. And then I'm going to go ahead and pull back for blood and flush it. And then I'm going to chart the date and time of the IV insertion, the patency and the size of the IV used, the dressing used, and I'm going to also note the patient's tolerance to the IV and the position. And then I'm going to go ahead and dispose of this in the sharps container and dispose of biohazard in the biohazard